Good morning, everybody, and a very warm welcome. It's my real pleasure to welcome you to this panel discussion event, Where Are We Now?, hosted by FoodTrain. I'm Michelle Carruthers, and I'm Chief Executive of FoodTrain, and I'm acting as Chair for this event. And it's going to be a bit glasses on and glasses off, I think, as we're running through this. So if you're not so familiar with FoodTrain, we have been making daily life easier for older people since 1995. A charity set up by older people for older people, with volunteers providing vital services such as grocery shopping, meals, befriending, household support, library services and so on, to those who are no longer able to manage independently through age, ill health, frailty or disability. Joining me today is our Eat Well, Age Well team from our project that works to address the issue of malnutrition, as we identify as undernutrition, in older people living in Scotland. This week is a really important one in FoodTrain's calendar, as it's the UK's Malnutrition Awareness Week and the fourth one across the UK. Our event today is being hosted as part of our campaign, Let's Build the Picture, where we're encouraging increased and improved screening for malnutrition in order to create a true picture of the issue in Scotland and subsequently help improve outcomes for older people. If you'd like more information on our Let's Build the Picture campaign and the work of Eat Well, Age Well, you can follow the work of us on social media and at our website, and you can see the information there on the screen. So 2021 has really developed from crisis intervention into a period of recovery inflection for us at FoodTrain. Like many other third sector organisations throughout the pandemic, FoodTrain's focus was about managing in a crisis and responding and working tirelessly to deliver lifeline services to older people in need in Scotland. And while we're still in very uncertain times, as things have eased across this year, it is allowing us the time to take stock of what's happened, what we've achieved, what the pandemic has taught us as a society, and what needs to happen next to ensure older people are able to eat well, age well, and live well in their own homes in Scotland. 2021 also marks 10 years since the Christie Commission, which called for the reforms in how public services are delivered. It also marks 6 years since the Malnutrition Summit, jointly hosted by Scottish Government and FoodTrain, where it was agreed more action, policy and partnership work was needed to address the issue of malnutrition in Scotland if things were going to change. At the start of this year, we also saw the publication of If Not Now, When?, the report from the Social Renewal Advisory Board, which also picked up food access in older people as an area for action. And furthermore, the independent review into adult social care by Derek Feely, all contributing. In August, the National Care Service consultation was launched by the Scottish Government, which sets out proposals to improve the way social care is delivered across Scotland. So with the theme of reflection and recovery in mind, today we want to discuss what has changed, how did it change, and what still needs to change for older people to be able to eat well and live well in later life. So this is our first Mentimeter question. Your thoughts are really important to us. So we're going to try and capture that through Mentimeter. We'd like to know what you think about where we are and what needs to change to ensure older people are able to eat well, age well and live well in Scotland. So I'll give you a little minute just to get yourself linked into there, and then you can add your thoughts. And while you're doing that, it's my great pleasure to introduce our panel for today's event. So firstly, a warm welcome to Professor Ian Welsh, OBE, who's Chief Executive of the Health and Social Care Alliance in Scotland. Ian has extensive experience across the public, private and third sectors and will be well known to many of you. Most recently, he was appointed by the Cabinet Secretary for Health to sit on the advisory panel for the independent review of adult social care, and also sits on a range of Scottish Government programme boards. Also joining us today is Lindsey Graham, one of the UK's independent food advisors. She's a leading expert on school food and health promotion. A former Highland-based community nurse and civil servant, she has worked in strategic positions in both the Scottish and English governments. Lindsay's also been a member of the Scottish Government Social Renewal Advisory Board on COVID recovery, where her focus was on food insecurity. A warm welcome this morning also to Karen McCurry from the MS, the Multiple Sclerosis Centre in Argyll. Karen's the manager of the centre there, where they support people with long-term conditions and those who are lonely and isolated, living across the mainland and islands in Argyll, where it's important that they have strong relationships with community members and local organisations and partners, which helps them to work towards the centre's aim of improving health and well-being within the community. And we're also joined this morning by Councillor Jennifer Adam-McGregor, who is Renfrewshire Councillor representing Paisley East and Ralston. She's a member of Renfrewshire's Health and Social Care Partnership, their Integrated Joint Board, and chair of the Paisley East Partnership, bringing a wealth of knowledge of local government, her lived experience as a ward councillor, and strong links to the local community. So before we move to our panel discussion, I'd like to introduce our keynote speaker for today's event. I'm delighted to welcome Maree Todd, MSP and Minister for Public Health, Women's Health and Sport. She's also MSP for Caithness, Sutherland and Ross. Ms Todd will share what Scottish Government are doing to help older people in this issue and how Scottish Government plans to meet its commitments on tackling malnutrition among older people living in Scotland. And just as Jen's getting the video loaded, we can see that we've got a great picture being built here on the screen with all your thoughts about what has changed from Mentimeter. It's great to see it building right in front of our eyes.
Good morning. I'm delighted to speak to you today as part of this year's Malnutrition Awareness Week. Now in its fourth year, this week is a valuable opportunity for people across different sectors to come together to raise awareness of malnutrition, to improve our understanding, and to consider what more we can do to tackle preventable malnutrition. And thinking about this past year and the impact COVID-19 has had on all of us, Malnutrition Awareness Week comes at a prudent time. Eat Well, Age Well has put together an engaging agenda for today's panel discussion, which I know will generate loads of useful insights. And whilst I'm really sorry to be unable to join you live, I hope my words will provide a helpful prelude to that discussion. I'd like to begin by saying that older people are a vital part of Scotland's future success, essential to our communities, our economy, our public services, and to society as a whole. Malnutrition, and here I'm speaking in terms of undernutrition, is wholly unacceptable. And I recognise that more needs to be done to better support older people to access healthy and nutritious food. COVID-19 has both exposed and exacerbated health inequalities in Scotland, and older people have been significantly impacted by health and economic and social harms of the coronavirus pandemic. As we move forward, we will identify and work to reduce barriers that older people face when accessing health and social care services. You'll know that we published a framework, A Fairer Scotland for Older People in 2019, to challenge the inequalities that older people face. This has included a commitment to work with health and social care partnerships and other stakeholders on practical actions to ensure that malnutrition is identified and managed quickly and effectively. The Scottish Government's priority over the past 18 months has been responding to the global pandemic. Clearly, this meant that some of our work had to pause while we did what was necessary to save lives and to protect the NHS. However, as we move forward, we will remobilise our efforts to take forward these important commitments. So while COVID-19 has delayed the progress of this work, I want to assure you that I remain committed to it. And through our funding of Food Train's Eat Well, Age Well project and Meal Makers, we're continuing to support vital work to lead on the prevention, detection and treatment of malnutrition in Scotland, and to tackle social inclusion amongst older people through meal sharing. As we work to rebuild and remobilise our health and social care services, we have clear opportunities to improve the lives of older people. As you will know, following the recommendations in this year's review of adult social care, we committed to bringing forward legislation for a national care service in the next 12 months. Our public consultation is open until the 2nd of November, I would encourage you to take part and provide your expert insight as to how our National Care Service can best support people to eat and drink well. You'll also know that the review recommended removing charging for non-residential social care. We fully accepted this recommendation and are committed to developing options to remove these charges as soon as it's possible. The Adult Social Care Review highlighted not enough progress has been made towards our ambitions for health and social care integration. Our proposals in the National Care Service consultation to reform integration joint boards will also strengthen the integration arrangements initially legislated for in 2014. With the support of a National Care Service, reformed integration joint boards will be better placed to provide high standards of care for the older people using these services and provide better support and training for the workforce in this sector. This brings me on to our health and social care workforce. We know that recruitment and retention has been challenging for some time, even more so in the past 18 months. Further work is underway to develop longer-term and sustainable improvements to the social care workforce, including better terms and conditions and improved training and development opportunities. We hope that this will improve the experience of the workforce and in turn improve outcomes for the older people served through social care. In March, my colleague, the Cabinet Secretary for Health and the Cabinet Secretary for Social Security and Older People, published a statement of intent setting out our commitment to develop a new strategy specifically for older people's health and social care. We are now entering an exciting period and engaging with a wide range of older people and the organisations that represent them to co-produce a draft strategy. I would really welcome your views when this draft strategy is published for consultation in early 2022. I want to touch now on the issue of food insecurity. You'll be aware that the Social Renewal Advisory Board was set up by Scottish ministers to make proposals that can renew Scotland once we start to emerge from the pandemic. Following the recommendations in their report earlier this year, we continue to do everything we can to make sure people are able to access foods that meet their needs and preferences. We've made the eradication of poverty a national mission. This includes tackling food insecurity and ending the need for food banks. However, I know that food insecurity for older people is not only linked to poverty, but also to broader issues of access. I know that loneliness and social isolation are strongly associated with malnutrition, which is why projects like Meal Makers are so important and have such a positive impact. We're continuing to support food responses that maximise dignity, whilst also being aware of how vitally important food is for our sense of belonging and well-being. Last week, we introduced our Good Food Nation Bill to Parliament. It places duties on Scottish ministers and certain public authorities to produce plans on food and set out what they will do to make those plans real. At the heart of our approach is our commitment to make Scotland a good food nation. We want everyone in Scotland to have reliable access to nutritious, locally sourced, locally produced, good quality food. This bill seeks to underpin in law the work that is already being done across government. It is the foundation upon which we will build our good food nation. Without doubt, I recognise that there is still much more work to do. For now, I'd like to thank you for this opportunity to reach out to you today and share some of our future ambition and plans as part of Malnutrition Awareness Week. I hope you have an engaging discussion this morning, and I really look forward to working constructively with you to ensure that all older people in Scotland have the resources and the support that they need to eat and drink well. Thank you.
Thank you very much there to Maree Todd, the Minister for Public Health, Women's Health and Sport, for her contribution this morning. I think really good to hear, and very sort of warm welcome, really warmly welcome the commitment to take forward the work that they had already started before the pandemic around working with integrated joint boards on tackling malnutrition among older people. You'll have seen from some of the press and social media that the screening data that Foodtrain has been gathering is showing people at risk at far higher levels than has been previously measured before. So we know the picture has worsened. So it's very warmly welcome that they are committing to take this work forward. Alongside the other pieces of work around the National Care Service Review, the Good Food Nation work, and most recently announced a new health and social care strategy for older people, things which I think I'll come up again this morning. So thank you to the Minister for her words. So moving on with our panel and our 4 guests this morning, here's a quick run through of our format. We've got questions that our panel will take in turn, and each guest has got their question that they're going to cover. And then the remaining time with them will be that other panel members will be able to join in. And at any point, if the audience has got any questions that they're thinking about for the panel towards the end, then please pop those in the chat box, and Tilly will have a look at those as we're going along. So firstly, warm welcome to Ian Welsh from the Alliance. Welcome, Ian, and thanks for joining us this morning. Our first question is for you and reflects upon the Christie Commission. So it's been 10 years since the findings from the Christie Commission report, which focused on future delivery of public services in Scotland, setting out priorities and recommendations which have become known as the 4 Ps. People and communities to be included in the design and delivery of services. Partnerships, services should work more closely in partnership with each other. Prevention, funds and resources should be focused on preventing negative outcomes. And performance, where public services should become more efficient, reduce duplication and share services where possible. So Ian, which of the 4 pillars recommended in the Christie Commission should have brought about greatest improvement and benefit to the lives of older people? And has this happened? If so, how? And if not, why not?
So as a former politician, you'll know that I've got a real facility for skirting the question. And it would take me 4 hours to answer that particular question. All of them have done something, and most of them haven't achieved enough. It would be the shorthand question. But I just wanted to put some context into Christie. Important as it book stops, if you like, the social renewal work that's going to be happening shortly. First of all, important to say, Christie Commission was an independent report on the future delivery of public services, and it set out a radical vision, as you've said, but it was focused on clearly laying out the consequences of no action, and it argued without change that a range of groups, including older people, would face greater inequality and an increasing poverty gap compared with the rest of the population. It also pointed out, I think, the inexorable demographic impacts and the costs of older people's services. 10 years ago, I was still an old person. 10 years later, I'm an even older person, well within the demographic that was cast there. Michelle, you're right, it was about prevention, it was about greater integration, greater collaboration, greater investment in the workforce, and a greater and sharper focus on improvement and innovation. And it'll be no surprise to you to hear all of those pillars reflected in the social renewal work and other work. The overall policy response to this at the time was substantial, I think. You'll remember the Change Fund for Older People's Services. You'll remember single outcome agreements for local authorities and community planning. You'll remember patients' rights legislation. You'll remember a really groundbreaking, innovative, collaborative approach to children around the GIFTEC approach. You'll fondly remember the Reshaping Care for Older People programme. And there was a strong pointer towards the structural integration of health and social care, which debate began then and ended up with the 2014 legislation. I would argue, however, that the resource response was comparatively limited. Over the period, there was a continuing, but as I would argue, limited investment in preventative spend and a policy wish through integration of reducing the demand for acute services over time and transferring resource from there to community activity and services. And neither approach has fully succeeded, other than I would guess in mitigating some harms. Not enough spend could be generated to be transferred into prevention, and virtually no transfer of resource from acute into community-based services has been possible through integration. And one of the significant asks of the Commission was that outdated attitudes and approaches needed to change. It called for a fundamental shift in attitudes and the design and delivery of public services, prioritising preventative action, building asset-based approaches, focusing on personalised services that were built around and co-produced with communities. Food Train is one of those. And I think Scotland has undoubtedly taken some significant steps in responding to the Cllr Commission with improved partnership working locally, with a whole raft of innovative activity around the country, largely in the third sector, I have to say, building better connections and relationships with people at community level. We've seen the adoption of asset-based approaches at a national level in law, policy and practice right across Scotland. The national standards for community engagement have driven, through good practice principles, good partnership working between public services and community groups. And there is a growing number of lived experience panels been set up for people who have experience of services, those that support them, convened to inform and influence policy and practice. The People-Led Policy Panel, the Older People Strategic Action Forum, the Social Covenant Steering Group, currently one among many of those. And crucially, third sector and community-led organisations will give you a host of key examples across the country of working in an asset-based way to improve health and well-being and tackle inequalities. All of those substantially improved over the last decade. However, it's undeniable that issues with overcomplicating governance persist, and we continue to see services built around structures rather than people. And neither, I would argue, have all the Commission's recommendations been fully implemented, and nor have all the bleaker outcomes that it warned against been avoided. In 2019, the Scottish Government estimated that 24% of families with at least one disabled person were living in relative poverty. For Malnutrition Week, 1 in 10 older people in the UK today either at risk of or living with malnutrition. Health inequalities are widening. The social determinants of health are under siege again. And 10 years of austerity have negatively impacted local authority budgets. That's unquestionable, with an ensuing impact on services, including those to older people. And the COVID-19 pandemic has further exacerbated these inequalities, and perversely left many of the third sector organisations which provided over the period key community services to older people, including many food services, has left them and others in financial risk through a lack of sustainable funding. Finally, I think policy platforms have to be rebuilt regularly to take account of tectonic plates shifting in society at large. And crucially, I would say, the legacy for Christie is that its philosophy remains at the heart of the independent review of adult social care. It is implicit in a Fairer Scotland for Older People framework, and it is at the heart of the forthcoming consultation mentioned by the Minister. And all those are really positives. But the challenge for us now is how to fulfil and develop those visions, those current visions, in the current context of austerity, of pandemic, of remobilisation, of human rights challenges, frankly, for older people, and for future public service reform. And who else would argue this? That means fully acknowledging the third sector as a partner with sustainable and secure funding for the third sector critical, and also critical people at the centre of all the decisions. And I think that is the real legacy, sustainable legacy of the Christie Commission. Thank you.
Thank you, Ian, for that. Some really quite stark words there about some of the lessons not learned, but some of the things that where we have made improvements, but some real lessons not learned, and the frailty of how social care and support for older people is resourced, massively impacting on their rights, their ability to be able to have the right to live and live well in their own homes. I'll just come to the rest of the panel, Lindsay, to Jennifer and Karen. Anything you want to pick up on there from Ian? Some real stark words in there.
Just to echo everything that Ian said about health inequalities and the growing gap that we've got, and our elderly are, one of the vulnerable groups that we've got, and we still haven't done enough. Everything you said there was just spot on, Ian, absolutely spot on. And I also think that the third sector do need sustainable funding. They're the organisations that have been closest to those in need during the pandemic, and those relationships, and that those trusted people and community leaders need to know that they're valued. So I think longer term funding and sustainable funding for the third sector is an absolute must if we're going to address malnutrition in the longer term.
If you give me a second, Ian, I had written some notes down, but my notes are such a shambles. They've all kind of merged into one another. So give me a couple of seconds. I would say, see, with partnership working, Ian, I sit in the Integrational Joint Board, and we've always said, the importance of supporting the third sector. I come from obviously a support group, a stroke support group I set up myself, so I know the importance of funding the third sector. I absolutely agree with you there. There was also something I wrote down there with regards to pathways, progression pathways when it comes to employment with the NHS, because there really has to be that. When you're having carers going in there, they've got to know that there's a pathway of progression that they can, if they go in there at that level, that they can increase, that there's a better way for them. But give me a second, Ian, as I say, I'll go over what I've written down and try and decipher it, okay?
Yeah, I also agree with what Ian was saying. And one thing I've noticed in the last few years that the partnership working with organisations is getting better. When I started in my role about 16 years ago, I felt that the other organisations who I needed to support me and what I was doing, people were quite precious about what they were doing, but there has been a change in that. And the only way to keep the third sector going is the tighter partnerships. If we all bring our own skills, we can improve our work, definitely. So it's very, very, very key, as is the funding, obviously.
Super. Thanks for that, Karen. Okay, thank you. So we're going to move on to question 2. And our second question is for Lindsey Graham and reflects upon the Malnutrition Summit held by Scottish Government and Food Train in 2015. The summit was seen by attendees as a good first step in bringing together interested parties, working together, committed to addressing malnutrition among older people. But a more joined up approach to both policy and practice was going to be needed to understand the true nature of the issue. Estimates show that 1 in 10 older people in Scotland are at risk of or suffering from malnutrition, a significant public health issue. However, from our own health and prevalence data, we think this is an underestimate, with as many as 30% of older people living in the community at risk. So Lindsay, what do you think has changed within Scotland since the Malnutrition Summit held in 2015? What hasn't changed and what needs to change now in order to address the issue of malnutrition among older people?
First of all, thanks very much for the opportunity to contribute today. I really, really appreciate it. And thank you, Ian, for your words as well. They were great. I remember that Malnutrition Summit well, Michelle, and I remember the enthusiasm and the ideas that reverberated around the room that day. I have seen, thankfully, some changes in one area that I'm very passionate about, and that was children's food insecurity. It was one of the topics that was discussed at the summit, and policy and resource in that area in Scotland has seen an improvement. In August, we saw the commencement of the rollout of universal primary meals, and we've also got holiday provision giving direct payments to families, and breakfast clubs are coming to Scottish schools next year. What I haven't seen as yet is the same policy action and movement for the other end of the age range. And it was good to see the Minister acknowledge that more needs to be done this morning. As a former community nurse, that really saddens me. And it also, I think, shames us all that we haven't seen movement. With my national lottery hat on, one of the developments that I must highlight is Food Train's successful 1.2 million award in 2017 to start the Eat Well, Age Well amazing project. It's been working with projects across Scotland, including some of those amazing innovation small grant awards. It's also got a valuable partnership with the Glasgow University as well that looked at really interesting research evidencing the links between malnutrition, social isolation, and the cycle of how food insecurity develops in older people. It's worth a read. Sadly, the Royal Voluntary Services stopped work on Meals on Wheels in Scotland in 2018. And as Ian said earlier, local authority budgets have meant the decline in valuable things like lunch clubs, with our third sector often stepping in and helping. And the pandemic showed that greatly. 2019 also, as the Minister said, saw the publication of A Fairer Scotland for Older People, which made brief reference to tackling and preventing malnutrition. I haven't yet seen how, really. In 2020, I was privileged to be part of the Scottish Government's Social Renewal Advisory Board for COVID recovery and contributed to its report, as you did, Michelle, if not now, when, along with many others in Scotland who have an interest in food insecurity. One of the calls was for government to ensure that everyone has access to nutritious, culturally appropriate and affordable food. And one particular point was to overcome non-financial barriers to accessing food, particularly for older and disabled people. There is a need to investment for long-term in local shopping and meal delivery services. As the Minister said, there is still work to do in this area. We need to learn from good practice in our own country and beyond our shores. And I know that some local authorities in Scotland are doing some great work on that. And I want to give a hat tip to Simon Shaw, a Winston Churchill's Fellow of 2019's work into models of Meals on Wheels provision in France, Italy and South Korea. It's worth the read. We have to learn from beyond our shores as to what works. Simon is now doing a piece of work on food and hospital discharge, which is an area I think we really need to look at. We must publicly acknowledge malnutrition is a problem, and one that is escalating with our ageing population and the health inequalities that we have. We need to invest, and in first and foremost, in prevention and to support screening and clear data collection on where we are now with the state of elderly malnutrition. Training that is multi-agency and cross-sectoral to recognise the signs and where to refer people for help. I think these actions need to be underpinned by national policy. We are in the midst of the consultation, as the Minister said, on a national care service for Scotland, which closes on the 2nd of November. And I would urge you to have your say and ensure you mention the value of food in our care system. We need more of those malnutrition camp champions we called for back in 2015 to lead the charge on change in our communities and at policy level. And finally, I want to finish with a quote that I read last night in Food Train's 2020 annual report. Food Train keeps me safe. Scotland has an ambition to be a good food nation with a right to food, and making those two aspirations a reality means looking at where we need to up our game in public service with a very difficult winter ahead of us, compounded for those on the lowest income with rising food and fuel costs. I think eliminating malnutrition in our elderly has never been more important than it is right now. Thank you.
Thank you, Lindsay. Some really moving words there, and yeah, I can just echo from the conversations that we have here with older people on a day-to-day basis. And I think absolutely agree and echo your thoughts around what has been put in place around children in relation to food, and where that model that we now have and is working just hasn't been translated into older people. And there's some elements of legislation that underpin that make it difficult. So thank you for all of that. I'll just open up to the rest of the panel now, to Ian and to Karen and to Jennifer for your thoughts on what Lindsay's shared with us this morning.
Thanks very much, Lindsay. Again, great to hear. Great to hear all of that. I think key issues for me are that you've picked up there. There's a need for training and for staff to be alert to the issues around undernutrition, and I'm very impressed by the screening pilot in Borders, which again is a potential for a kind of national rollout there. I would also I posted a comment about the Scottish Food Coalition, and I'm just conscious after my Christie Commission stuff that it was kind of indicating a general unhappiness with the rate of progress, but it really just was a reflection in a decade, and loads of other stuff happens in a decade. And one of the things that has happened has been further to the Malnutrition Summit, has been a great build-up of a common purpose and common approach through organisations, through Nourish Scotland, through the Scottish Food Coalition, through local services. And that's a fantastic driver for change. And that's why I think there's going to be a good food bill, a good food bill. And I'll pick up on this in the national care stuff. I think it is a problem that some of the big consultations over the last 5 or 6 years, the dementia strategy, the SDS legislation, even the independent review, I helped write that paper, weren't a bit more express about right to food. However, I think we're on the cusp of addressing that. And just finally, I think it's absolutely, the pandemic has taught us that undernutrition is also a friend to low income, to loneliness, to social isolation. And that kind of cluster of policy imperatives sit together. And that's why they need to be tackled in the next few years.
Super. Thank you very much for that, Ian. And I think we've seen specifically at Food Train over the last 18 months, a huge influx of new older people needing our support, who were probably on the cusp of much greater needs, but a really serious decline in their general physical and mental condition over the last 18 months. And for many of them, if it hadn't been for the third sector, we would be seeing people in a much more dire state than they are. And I think there is an element of me that is saddened that it seems to always fall to the third sector to be driving some of this and pushing. But it is also our job to speak up and raise the voices of the people that we support. So I'm going to move us on to question 3 now, and Karen McCurry is taking question 3. So Karen, in January 2021, the Social Renewal Advisory Board published If Not Now, When, that Lindsay was referring to. The report outlines a series of recommendations to Scottish Government to make proposals that can renew Scotland once we start emerging from the pandemic. Call to Action 8, specifically in the report, recognises the challenge of food access and includes explicit reference to older people in tackling non-financial barriers to food. So the question for you, Karen, what changes do you feel are needed to ensure Scotland's older people can eat well for their physical, mental and social well-being?
Okay, thank you very much for inviting me along, giving me the opportunity to talk today. To answer the question, I'm going to focus my answer on the community that I support, which is the older people in Argyll, the mainland and islands, and those living with long-term conditions who often need social care support, as well as support from the third sector organisations. I'm sure that much of what is needed for our older people in Argyll will also be what is needed for older people right across Scotland. I've also decided to focus my answer on 3 controllables that I, as a member of my community and as a local charity leader, can do to support older people to live healthier and happier lives. So these 3 controllables are, firstly, educating, secondly, connecting, and thirdly, improving access to food. So firstly, looking at educating. By this, I mean having the conversations, simply talking about the importance of ensuring that older people are well nourished and hydrated. More awareness around the risks of an older person becoming undernourished and the importance of keeping hydrated will help educate the important people in an older person's life. For example, their family, carers, their neighbours. They'll be educated to look for the signs of undernourishment and to be able to have open conversations around food with that older person. Connecting, people need people. And yet many older people tell us they feel isolated and lonely. I think as a society, we need to ensure that older people are valued. They feel valued, they are needed members of our community, they've still got much to give to others. Long-term funding is needed for organisations to be able to offer many more opportunities to keep people connected at the level that best suits their own unique needs, be that access to various activities or home visits. And thirdly, the improved access to affordable food. With the food and fuel prices hiking and reduced choice, this has never been more needed. So in the MS Argyll, we are focusing on these three controllables by offering small projects to our community that could easily be scaled up across Scotland. Starting with the education, we used the Eat Well, Age Well Malnutrition Toolkit to have conversations with older people who attended our events, our coffee mornings, centre activities, as well as one-to-one home visits through our outreach project. We've offered training to care organisations focusing on person-centred needs, and we've discussed with carers the signs to look out for that an older person may be losing weight. During lockdown, we started cooking classes for older people via Zoom. And during these sessions, we discussed eating well on a budget while preparing simple, nutritious meals, often using the Food Train recipe book. We run smoothie making sessions, showing carers how to make calorie-rich smoothies, for example. We had one man who had dementia. He would only drink Ribena. He refused food. His wife was naturally very concerned. So with her, we made nutritious, full-fat smoothies with berries to recreate the colour and the taste of Ribena. And we were delighted when she said that he ate them and enjoyed them. We also discovered through talking to her that she too was not eating, that she felt guilty when he was refusing. So with her again, we made smoothies that she would enjoy. Importantly, she also enjoyed the half-hour respite to come down to the centre and make the smoothies and collect them to take them home to him. Another example of someone who was not eating was a lady who received outreach visits. She used to cook with our outreach worker, and she would choose the recipes she wanted to make. As her neurological condition deteriorated, she became bedbound and could only eat blended food. She could no longer taste food. Yet every fortnight, our outreach worker would go down and she would then cook the soups the lady had carefully planned. The soups are bagged and frozen and reheated when our carers come in. Previously, she had blended microwave meals, which she refused to eat. She enjoys the homemade soups and eats them all, not because she loves the taste, because she can't taste the soup, but because she, as an older adult, is finally back in control of what she chooses to eat. Now, for connecting people, the older people who live alone have told us that the most difficult part of their day is mealtime, as they feel lonely eating alone. Many are grieving a partner, and they say this is a time where they would feel most alone, as they're not getting the conversation, sitting down, having a meal with a partner. And as a result, they don't feel hungry. It is our aim to reduce the feeling of loneliness and keep people connected in many ways, from daily texts, telephone calls, to home visits for those who can't come to us. During lockdown, we delivered soup and baking twice weekly to older people living alone, and we had many great doorstep chats. We still maintain contact with them. We have various physical activity groups, we have craft groups for older people, and at these groups, we provide homemade soups, teas and home baking. And when the person leaves, we ask them to take some extra soup for themselves and any neighbours if they're concerned about. This then leads on to more doorstep chats as the soup is given out. Being connected, and active together helps people feel happier and less lonely. And as a result, they're more likely to eat better. With improved access to food, our rural community as a whole faces barriers to accessing good, affordable food. Argyll has some of the best food providers in Scotland, yet for those on a lower income, affordable food choices are both limited and the price is high. To help, we became partners with ACT, and that is the Argyll and the Isles Coastal Countryside Trust and our local co-op store in Lochgilphead. And we run a daily free food share project using surplus food The tables are often heaving with produce outside our centre. The beauty of the food share, as well as reducing waste, is there's no stigma collecting the free food. Every person who comes along and collects a wide range of fruit and vegetables is thanked for reducing food waste. It's a lifeline to some who are struggling to afford food, but it's also a social contact point. People meet outside the centre at the food share tables and have a blether. Every supermarket should partner with an organisation to distribute surplus good quality food to their community. So to hear more about what we do, please know that you're welcome to visit us in Argyll. If you do, please remember to bring a bag and fill up at our free food share. Thank you for listening.
Karen, thank you so much for that, and just so lovely that you brought it all back to people and the warmth of stories about sharing food and how important it is for people to eat together. You know, food is just a universal connector between all of us. It's about love, it's about sharing, and it's about nourishing our hearts and minds as well as our bodies, isn't it? So just lovely, you know, to bring it back to that. And it actually just shows we have got so many of the solutions at our fingertips in Scotland. What we're lacking is national policy and leadership on this. I'll just, if any of the panel want to come in, Jennifer, are you looking to come in?
Karen, I really enjoyed that. I really did. Everything you said, completely agree with you. Education, staying connected. I've been working quite closely with Cllr, a Connection for Life. They're for the elderly in their not-for-profit organisation and within my ward, and they do exactly that. They have the lunch clubs, they cut the toenails, all of these things. But sorry, my point was they've got a programme, Stay Connected, Stay Mobile, Stay Connected, and that was it. So Stay Mobile was making sure that you weren't losing the strength in your legs, so your seat to stand position, and Stay Connected. We've done a programme where the partnership funded tablets because we believe that would hopefully be a bit easier for them to work with to try and get them to come online. But listen, see what you've done there. We've got a community champion in Paisley. He's from Fergusley and he's done tremendous work. Like you say, Karen, we've got a community market. So the co-op comes through loud and clear because that's exactly what he does. He goes to 4 co-ops, he picks up the food and then he puts it in a community market. As you say, there's no stigma, you know, people can just go along and it helps towards wastage. But I would really like to catch up with you after this, Karen, because if there's more that you do that I could take to Renfrewshire, then I'm all for that. So if I could get your number after the meeting.
Yep, absolutely, we'll do that.
And thank you very much for your contribution because I really enjoyed that. Thank you.
Fabulous. Thank you, Jennifer. Ian, you're looking to come in there.
Yeah, that's fantastic, Karen. Really enjoyed that, and it reminded me a lot about working locally, focusing on controllables, doing things really important, reaching out, training to care orgs, again very important, cooking classes, all those things. And again, it reminded me. Julie Twaddle's on the call here, but I chair Dementia Friendly Press Week, and Julie has been leading on our food distribution programme through the pandemic, and I'm sure the point you make about providing food's one thing, but providing company and doorstep chats and all of that is so important for activity. And the fair share thing resonated. I'm very conscious. We've got an organisation in Ayrshire called Centre Stage that turned fair share into an industrial output, almost taking fair share, and actually on the basis really that when they went to the poorer areas to get kids involved in theatre and drama and all of that activity, the first thing they wanted was something to eat. That was the catalyst there. So they now have that as part of their social enterprise activity. And I think that's a message. But just Michelle, just to conclude, just struck me very strongly, and I was trying to remember the quote, and a quote that will be known to many of you. Eleanor Roosevelt, where after all do universal human rights begin? In small places close to home, so close and so small that they cannot be seen in any maps of the world. And that's the impact of the local food initiatives. And I said that was my final point, but it wasn't it really. I also wanted to say, again, that business, to pick up your point, Michelle, the community larder activity that has kind of replaced food banks as a more productive way, and to echo on your point, Karen, is so important. And the fantastic work that's been done in some areas around good food. I'm thinking of Glasgow in particular, where I know a wee bit about the Glasgow City Food Plan. That patchwork of local provision actually builds towards a national platform. So the leadership that hopefully will come with the forthcoming bill is really, really crucial to give us a catalyst for momentum.
Definitely. Thank you for that, Ian. So we're going to move on now to question 4, and that is for Councillor Jennifer Adam-McGregor. So the independent review into adult social care was published in February 2021. However, at Food Train and many other organisations we know of, we felt a significant omission in the review is a recognition of the importance of food, nutrition and food support as part of adult social care. So as an older people's champion and reflecting on what your ward constituents' experiences and feedback to you, what do you see as the most important things to older people about food and eating and the barriers they face to eating well?
Thank you, Michelle, and thank you all for asking me along here today. As I say, I'm Renfrewshire's older person's champion. I actually volunteered for that position myself because I'm a member of the Integrational Joint Board, but at 25 I had a massive brain hemorrhage, so it resulted in a stroke and it paralysed my body on the left-hand side. I had to go into rehabilitation, and I found myself being the voice for the demographic that we're dealing with now. So it was an obvious choice for me to be the old person's representative when it came to it. So as I say, I work very closely with ROAR. I've spoken to them over the last couple of weeks, and a lot of my constituents as well. And what I laugh at is some of them don't think they're old enough to answer. They're like that, well, from what I noticed about the old ones at the club, and I think, well, you're actually 89 yourself, you know. But so what I have came through, I put motivation at the top because I know myself with having a physical disability. I know that if I'm home alone, I'll not feed myself, as in if my kids are here, I'll make sure I get up to feed them. But so I know that is definitely the same as you get older. You know, I've got financial barriers. Obviously, heating household energy has been up 400% since January. So that's a massive, massive barrier. Online barriers, I've got, you know, they want to keep it at arm's length. They have a kind of built-in distrust of feeling that there's going to be a fraudulent transaction come out of an online. So even though we've tried to make strides, you know, ROAR have had the Stay Mobile, Stay Connected campaign, but see, when I actually saw the figures of how many elderly people we'd managed to get on a digital platform, I was actually pretty disappointed. So that's something that I would really like to work harder on to try and get them. As I say, old age doesn't come by itself. So as we age, we become more frail. And then if we're not having the nutrition, guaranteed we're going to come down with every illness that's around us, you know. So it really is important. I like what you were saying about the toolkit, you know, being able to, the malnutrition toolkit. I think that's something that's imperative that we have, that the HSCP roll out if they haven't already, absolutely. As I say, I've got wastage. That's something that came through loud and clear. They couldn't stand wastage. So a lot of them were saying, I'm actually just buying a pot noodle, you know, so they can actually just heat it, eat it, and there's no waste. So one or two of them actually asked me if I could approach Aldi's and ask Aldi if they would consider in the middle aisle making a kind of single person's portion section. People have said Aldi are always very, you know, they're very responsive in getting back to the customers. And when they suggested that, I thought, absolutely. So that's something that I'm going to approach, you know, to see whether that's something we can do. But as I say, wastage, finances, physical barriers. And that's why an organisation like Food Train is so imperative. And in fact, I didn't actually even realise that you work in my own area until a couple of volunteers reached out to me. They're actually attending this meeting today and they said, I actually volunteer within your area. So tremendous. And I'm absolutely all for becoming a volunteer myself. You know, I can drive. I might not be so good at carrying the messages, but count me in for just dropping off. And a befriending service, because see, as you say, isolation and loneliness, they say that's actually as dangerous as smoking 5 cigarettes a day. And I know that my eldest, she says to me, she goes and cares for quite a few, you know, of the family. And she says, it's not until I come into the house. She goes, that they come into the kitchen right behind me and they'll say, oh, my biscuits are there, my food's there. So it's the interaction, as Karen said, of having somebody there that will make you actually think, give you the motivation to get up and get into your kitchen even. So that's such an important element, you know, that your outreach program, being able to talk to people on their doorstep, because isolation can actually bring on. My husband went to, he's a roofer, he went to see somebody I know yesterday, and he came back and he says, I think the old chap's got dementia. And I said, no, he hasn't. I said, that's because he's been isolated in his house for the last 19 months with very, very limited contact. And that's how we can present, you know, to somebody who doesn't know them. So absolutely the human contact can. And so that's the barriers as I see it. You know, I see financial, I see physical, I see online, and I see wastage. So that's my take on it.
Super. Thank you so much for that contribution, Jennifer. And yeah, absolutely, it's something we see regularly when new members come to us at Food Train, is that motivation and the loneliness, and they've maybe found themselves bereaved and having to shop for themselves and plan and think about meals, and you know, it's just that sort of, oh, just whatever's easiest, you know. But it's amazing that, you know, the relationship building with volunteers, talking about food, enthusing people about, well, do you know, you could try that. What about, you know, pop this on the shopping list? And it just doesn't take long, but it's very much about these human connections.
Karen was saying about making the meal for somebody, you know, I mean, we do that anyway. We've always done that. You know, we tend to feed the couple next door. Well, she's by herself now. So we have always done that. But that is a tremendous thing as well, because it's something so simple that you're so, I mean, you're feeding a family, you tend to feed the 5,000, you know, you absolutely, I've never been able to quantify for when my kids leave. I go, right, I'm still buying all the same amount of food. So that's something that, you know, we could all do very easily without even making big changes. But no, thank you, Michelle.
Exactly. Thank you. So I'll open up to anybody else in the panel, Lindsay, Ian and Karen, if you've any thoughts and reflections on Jennifer's, which Jennifer shared with us this morning.
Just to say, Jennifer, my niece used to run the food train service in your area. Michelle was glad to see the back here. But I can tell you just because I know food train got a huge traction in Renfrewshire because of the how can I describe it? Because of the support, the implicit support they got from elected members, and many others, and fantastic partnership working with Roar, for example, who I've posted a thing there, who themselves are a terrific capacity building organisation locally. I think the point I would make to yourself is I used to chair an IJB as well, and one of the key things for me, what we did in East Ayrshire where I chaired, we actually ring-fenced money from the budget for the third sector. We were one of the few organisations to do that, and we protected it when money was tight, as it inevitably was, and that's a basis for my call to Scottish Government to provide that kind of quantum of money, but to provide it directly, either through TSIs working locally or through anchor organisations, many of whom have set up really during the pandemic, so that there is an independent way to fund third sector eco-cultures for health and well-being. But that's another debate. And finally, just to say, you know, the framework that I mentioned earlier, you know, fronted by Christina McKelvey, herself a doughty fighter for older people, is a good basis to take us all into this forthcoming consultation and strategy for older people.
Super, thank you for that, Ian. Super, thank you very much to the panel for their thoughts there. I think Tilly has been busy gathering some extra questions for you. So I think we're just about ready, if Tilly gives me the nod, and I'm going to let Tilly pop some questions out for the rest of the panel from the audience. Over to you, Tilly.
Thanks so much. It's been such a great conversation, and really great to get the audience questions to hopefully continue what we're discussing. So we have one question, well, a lot of questions about the Good Food Nation bill, and obviously it came out last week as a draft proposal. So just a very broad question really about what your thoughts are on the Good Food Nation bill, and I suppose, what do you think should be part of a good food nation? Like, what characteristics do you think are vital to make Scotland a good food nation?
Lindsay, I'll maybe ask you to come in on that one first.
For me, I think we do need clear policy. That would be the one thing that I would say. And also that it acknowledges Scottish culture and the current challenges that we have. I mean, we're facing some real challenges now that we didn't have when we started the road to the Good Food Nation. And I think, you know, we need to be thinking about how we're going to address those challenges and the resourcing behind it. It's a wonderful ambition, but for me, we need to be very clear about the resources that are going to support that kind of legislation and what specifically they will be targeted to.
Super, thank you, Lindsay. Ian, thoughts on the Good Food Nation?
Yeah, plenty. Full incorporation of the right to food in Scots law, or further to the Supreme Court decision on UNCRC, maximal incorporation of the right to food in Scots law. A national food plan. I talked about the Glasgow food plan. It'd be good to have an overarching national food plan and an obligation on partnerships and others to produce local versions of it. I saw a comment from a gentleman about what was in the face of the bill. Always better to have targets in the face of a bill rather than bland statements there. I think we haven't had that, and that's a worry. But the consultation could make a difference there. Always important to have duties in public bodies. That's a thing, not a wish. A duty makes a difference, and an independent food commission, I think, that would sit over that and provide a kind of conduit for research, connection, international, expertise, and kind of monitoring and been a kind of honest broker for change.
Super, thank you, Ian. Tilly, we've got another question that we can put to the panel.
Yeah, thank you for that. And Finley Carlson has replied in the chat to say about making sure people do submit their comments. I think there's such a wealth of knowledge and expertise, and when it does go out to a call to evidence, to make sure people do share their thoughts. And we do sit on the Scottish Food Coalition, so if you want to channel your thoughts through Eat Well, Age Well, that's would also be great. So I thought it'd be good to chat about a response to the Minister herself. She raised a particular question around how can the National Care Service support older people to eat well and drink well. So directly back to the Minister, what would you say?
Hey, Karen, I'll maybe come to you first for some thoughts on that one.
I think just ensuring that the funding, no, I'm okay, I'm not on mute. Ensuring that the funding's there for organisations and the resources. And if everybody thinks, just as we were talking about earlier, becoming as an individual, as an organisation, looking out for your community, being a good neighbour, it doesn't take a lot. It's quite simple things that can be done. What we do, we're doing it with only 2 full-time members of staff and 1 part-time, but our reach is far. We're covering this huge area. So it's not taking a lot of funding because we're working with good partners. But we're just, I think that's just don't know how to say it exactly, but you can make big changes by just doing small acts. So it's not a lot of funding resources, but we can make a big impact in our community by being a good neighbour, basically.
Super, thanks for that, Karen. And I think we, across all parts of Food Train would absolutely echo about the importance of food as a vehicle within social care and the recognition that it is a big part of people's day. And it's not just about the food itself, it's about the connections that brings with other people into your lives, So Ian, some thoughts from you maybe on that?
Yeah, I mean, just to pick up the point, the review was conducted, as you know, Michelle, under a very kind of set of extenuating circumstances, and we took Tilly made sure that there was good evidence into the National Care Service consultation, and I guess food with a whole range of other stuff wasn't included in that process, but it was connected, you know, the issues were connected through all our discussions with officials. And I think my key message is it's a national care consultation process now, rather than, although they're going to track recommendations back to the independent review, it's consultation itself now that will determine what's there. So I would urge everybody to make a good connection with the proposed Good Food Nation activity, right? And there's nothing better than making connections across distinct strands of policy. So making National Care Service consultation link into Good Food Nation activity is crucial. And I agree with Julie, not a lot of resource is required, but where that resource sits very often is where the issue lies, which comes back to my point about, you know, third sector and loads of that work. And the model for that work in the third sector through the pandemic was liaison with one or two officials, people in the council, and liaison across organisations that were working in food, if you like. So I'd like to see a connection built there around not quite hypothecating resources, but building resources, a resource fund for that kind of work.
Okay, super. Thank you for that very much, Ian. And I think we're probably coming up to about the end of time. I know Tilly's gathered lots of questions and we'll try and get responding back to people with as much as we can. And obviously, as I mentioned at the start, you know, we're doing a recording of this and we'll be turning it into a podcast, and hopefully the discussions will carry on behind the scenes. So we're just going to finish up with our final Mentimeter question, which is just going to hopefully pop up on your screen now. And we'll see if we can build another lovely word cloud from that. And we can capture those as well. And that also helps contribute towards what we're feeding back into the consultations. So what do you all feel needs to change in order for older people to eat well, age well, and live well in Scotland? And I'll just let you work away populating your thoughts into that. The link is on there with the numbers there. And if you pop your answers in. And as we're gathering all that together, it just very much falls to me to say a huge thank you to everyone who's come along and joined us for this conversation this morning. Our campaign, Let's Build the Picture, is about conversations with older people around food and being able to eat. And we've had a superb conversation this morning, thanks to everyone who's come along. A thank you to our speakers, to the Public Health Minister, Maree Todd MSP, to Ian Welsh, to Lindsey Graham, to Karen McCurry, and to Councillor Jennifer Adam-McGregor. Thanks also to Ellie Sandercock, who's been sketching notes of the meeting this morning. And a huge thank you to all of you. The Mentimeter is building in front of our very eyes, which is fabulous, and we'll continue to capture all of the data from that. You can follow all the work that Food Train is doing around food and food access and malnutrition and older people and social isolation and all of our projects on social media. And you can get involved with the Let's Build the Picture campaign, looking at see what Eat Well, Age Well as part of Food Train is doing on their website and social media too. And we'll send out a link to a survey after the event. So please send us your feedback and you can use it as a mechanism to add in any questions as well, as it's really important to us. So a final thanks to me to all of you for coming along this morning, to all of our fantastic speakers. I think we've got such great common feeling that we've got some good stuff going on here in Scotland. We're good with food. We know what we're doing. We're good with people, and we just need a better mechanism to bring it all together. So huge thank you to everybody, and I would say safe travels, but it's just a click off this morning. Thanks very much, everybody.